In that session, we are going to talk about the anatomy of the skull from different aspects, developmentally, the main points of the how to name the sutures, how to name the processes, how to look to the skull from different aspects, and from inside. We'll try to get around the skull and make it as simple as possible. That is how it looks like the skull at birth, with the main differences between that skull and the adult. Will find that the flat bones at birth are separated from each other by narrow sutures or connective tissue, which are derived from two sources, these sutures. The neural crest cells, that is the sagittal suture, the paraaxial mesoderm, that is the coronal suture. At point where more than two bones meet, the sutures are very wide or wide and are called fontanelles. The most prominent one is the anterior fontanelle, which is found between the two parietal and the two frontal bones. The other differences in the skull at birth is mainly the facial part of the skull, which measures 1/8 in the at birth, and it is 1/2 in the adult skull. And this difference due to the small size of the maxilla, because the thymus is not well developed, that is the maxilla here. The small size of the mandible with non-erupted teeth, as you can see here. And the orbit are large in relation to those of the adult when compared to the size of the skull itself. The teeth, developing teeth, lie very close to the floor of the orbit. That is the orbit here. The glabella, the part over here, the superciliary arches, which are supposed to be over here, and the processes, the mastoid process, are not developed. This is the area where the glabella and the two superciliary arches are found. The frontal and the parietal tuberosities are prominent. The other differences are the base is relatively short and narrow, that length of the base compared with the adult. Stratification of the bones are not complete. So many bones consist of several bony elements united by fibrous or cartilaginous tissue, example the maxilla, the occipital bone, the sphenoidal bone over here, the frontal, and the mandible. The mastoid process, as we said, does not or has not started to develop. It is not shown here. The paranasal sinuses are rudimentary or absent. One of the major bones which show difference between the skull at birth and the adult is the temporal bone. Here you will find the internal ear, the tympanic cavity, the auditory ossicles, and mastoid antrum. Those are responsible for hearing are almost of the adult size, so the child can hear completely uh, at birth, exactly like that of the adult. The tympanic plate is represented by an incomplete ring. You can see here that is the tympanic part of the temporal bone, which is consisted or looks like a ring here. The mastoid process, as we said, does not start to develop. The external acoustic meatus is short, straight. Its body part is not ossified and represented by fibrocartilage ring. Due to the absence of the mastoid process, The stylomastoid foramen is found on the lateral surface of the skull, so the facial nerve is very prone to injury. The styloid broth has not fused with the bone, and the mandibular fossa is flat and more lateral. That is the mandibular fossa over here. The articular tubercle has not developed. There is no tubercle over here. The fontanelles and sutures of the skull at birth, the anterior fontanelle is here, the posterior fontanelle is here, the anterolateral or sphenoidal fontanelle, the posterolateral or the mastoid fontanelle, frontal or metopic suture is there, which usually disappear by the age of second year, but may persist in special speeches. The sagittal suture, that one, and this is the lambdoid suture. For the anterior fontanelle, it is the one which usually fuse at 18 months of age, while the other fontanelles between 0 and 3 months to fuse. That is the coronal suture. So these are the fontanelles on the left side, and the sutures are on the right side. Now we'll come to the adult skull. In that session, we are going to talk about the anatomy of the skull from different aspects, developmentally, the main points of the how to name the sutures, how to name the processes, how to look to the skull from different aspects, and from inside. We'll try to get around the skull and make it as simple as possible. So let's start by the developmental background, where the skull is divided into two parts when it comes to development. The first one is the neurocranium, and the second part, which we call it the viscerocranium. The neurocranium forms the protective case around the brain, divided again into two parts: a membranous part, which consists of the flat bones forming the vault of the skull, and the cartilaginous part, which forms the bones at the base of the skull. So the membranous part, derived from two sources, neural crest and the paraaxial mesoderm. The mesenchyme from these two sources will invest the brain and undergoes intramembranous ossification. The second part, which is the condor cranium, the cartilaginous part, consists of several separate cartilages, and those cartilages are the precaudal condor cranium, and this is in front of the rostral limit of the notochord, which ends at the level of the pituitary gland, in the center of the sella where that gland lies, and this is derived from the neural crest. The caudal chondrocranium, this lie posterior to the limit of the sella and arise from the occipital sclerotomes, which formed by the paraaxial mesoderm. The base of the skull will be formed when those cartilages fuse together and ossify by endochondral ossification. Now the viscerocranium in the second part, which form the skeleton of the face mainly. The mesenchyme is derived from the neural crest and is formed from the first two pharyngeal arches. The first arch will give rise to the dorsal portion of this arch will give rise to the maxillary process, which extends forwards beneath the region of the eye and gives rise to the maxilla. the zygomatic bone, part of the temporal bone. These are the three divisions or the three parts which develops from the first arch or the dorsal part of it. The ventral portion will give the mandibular process, the Meckel's cartilage, which contain the Meckel cartilage, and this cartilage is found intramembranously to give rise to the mandible. The Meckel's cartilage disappear completely except the sphenomandibular ligament. Lip of the mandibular process along with that of the second pharyngeal arch later will give rise to the incus and the stapes, the ossicles of the middle ear. Now, the source of origin, a summary of the source of origin of the skull bones, those appear in blue are structure derived from the neural crest. You can see the nasal, lacrimal, zygomatic, the maxilla, the mandible, the frontal bone. These are the bones which arise from the neural crest or derived from it. Those in red, structures which are coming from the paraaxial medullary, the somites or somatomeres. You can see the parietal, the occipital, and part of the temporal. Those in yellow are the structures derived from the pharyngeal arches, and those are mainly the laryngeal cartilages. That is the skull development background. Now, the skull at birth, how it looks like the skull at birth. That is the skull at birth, where if we look from the norma verticalis from above, you can see the different bones are separated by these sutures here and here. So that is the main difference between the skull at birth and the adult. So the flat bones are separated by those sutures, which are formed of connective tissue, and those sutures derived from two sources: the neural crest cells, which will form the sagittal suture, the paraaxial mesoderm, which will form the coronal sutures. Those sutures are at point where more than two bones meet. Sutures are wide and called fontanelles. The most prominent of these fontanelles is the anterior one, which is found where the two parietal and the two temporal bones meet each other. That is the anterior fontanelle. Other difference between the skull at birth is mainly of the facial part of the skull, which is formed of or form about 1/8 of the size of the skull at birth, while in the adult it forms 1/2 of the size of the skull compared to the size. This due to those factors: the small size of the maxilla, where the sinus is not well developed, the small size of the mandible also, and the non-eruption of the teeth. The orbits are large compared to the size of the skull itself. The germ of the developing teeth lie very close to the floor of the orbit. That is the orbit here. The glabella in the middle of the front of the skull between the two superciliar arches are not developed, and also the mastoid process. That is the mark of the area where the glabella in the middle and the two superciliar arches on each side. The frontal, the parietal tuberosities are more prominent. That is the frontal, and this is the parietal tuberosities. Looking from the side to the skull at birth, we can see the base is relatively short and narrow. Here you can see that the length of the base. Ossification of the bones is not complete, as you can see here. Many bones consist of several bony elements fused together with cartilaginous tissue. The example is the maxilla, the occipital, the sphenoid, the frontal, and the mandible. All these bones at birth are not complete fused with bones. The mastoid process, as we said, does not start to develop. That is the mastoid part here. The paranasal sinuses are rudimentary or even absent. The important bone which shows many differences between it and the adult bone is the temporal bone. Here in the temporal bone, the internal ear, the tympanic cavity, the auditory ossicles, the mastoid antrum are almost of the adult size, and this is the parts responsible for hearing. So the child can hear exactly like that of the adult, and this is a very important function for the child. The tympanic plate is represented by an incomplete ring. Here it is not well developed. That is the one. The mastoid process, as we said, is not started to develop. Here the external acoustic meatus is very short and straight, so infection is more easy. Its bony part is not ossified and represented by this fibrocartilaginous ring. Moreover, due to the absence of the mastoid process, the stylomastoid foramen will be looking on the lateral surface. The facial nerve which comes out from this foramen will be easily injured. And lastly, the styloid process does not or has not fused with the bone, and the mandibular fossa is flat and more lateral, and the auricular or the articular tubercle is not well developed. That's all about the some of the differences between the skull at birth and those of the adult. Now, looking for the skull at birth, we'll see some fontanelles and some sutures. The fontanelles are the anterior fontanelle, the posterior fontanelle, the anterolateral one or sphenoidal fontanelle, the posterolateral or mastoid fontanelle. These are the major fontanelles here. All of them will disappear by the age of 3rd month, between 0 even at birth to 3rd month, except the anterior fontanelle, which will remain until the age of 18 months, and this is used for follow-up of the growth of the child, and it has a lot of uses. The other sutures are the frontal, which is the metopic, and this disappear by the age of 2nd year. It may persist in certain species. The sagittal suture is this one here, between the two parietal or interparietal. The lambdoid suture, which between the occipital and the two parietal. The coronal suture, which is between the frontal and the two parietal bones. These are the main fontanelles and sutures at birth.